everybody, I'm back. I'm Dr. Kim, who is one of 5 Director of Global Academy of Integration. Today I came back with the sinus graft redo case after perforation. So 46 years male patient referred from my colleague because he had a perforation during the right side sinus graft. So this is revisit case for right maxillary sinus graft, and he also asked me to do the left side extractions and the sinus graft for dental implant. So from the CT scan, you can see the previous opening here on the anterior lateral wall, okay, and also you can appreciate the periodontal defect on the number 26 left upper maxillary teeth. So during the surgery, during the operation, when I opened the flap and the dissected area, previous opening site of the sinus, so you can appreciate there is soft tissue left on top of the sinus membrane. I'm gonna explain detail in the movie clip. So after bone graft, sinus bone graft, and the cover with the PRF membrane, which I prepare prior to the sinus graft, then closed. So I used the mix with the interrupted suture and horizontal matrix sutures. So let's see the movie clip. So I made the incision part 6 times faster. So when I open the flap, until I meet the previous opening site, I do very carefully. Then this sinus graft part, like a window, was not covered from the beginning, so from the last work. So it has an adhesion between the sinus membrane and the periosteum. So if you want to divide, if you try to divide between the sinus membrane and the periosteum, you may have perforation on the sinus membrane. So this time, what I did was I separate, not between the sinus membrane and the periosteum. I tried to dissect it above the periosteum, so between the muscles and the periosteum. We cannot do it with the number 9 periosteal elevator, so this time I use the tip of the number 15 blade or back side of the number 15 blade. So I do little by little, then I dissect it with the number 9 periosteal elevator, and if there is adhesion, I do more with the number 15 blade. So once you expose like this, so here you can see the periosteum attached to the sinus membrane. Then you do careful dissection with the FLIR elevator. Most of the time I do medial and distal first, a little bit of above, like a superior area. So what I'm doing now is I'm dissecting on the distal, medial and distal area. This FLIR elevator is included in the SLA kit from the Neobiotech. And once I finish with the medial and distal, I'm going to go to the downwards, like a lower area. So with the rectangular angle, this is number 2 FLIR from the SLA kit. So you go down. But one thing you have to notice is when you use the FLIR elevator, this is not the pulling out action. You have to use the push out with the tip touching the bone. So the end of this instrument, so tip of this instrument has to touch the bone. Otherwise, you will have perforation on the sinus membrane. Now I'm using number 2 FLIR wider angle to go far. Then I use number 3, twist it like a double twisted FLIR for the medial and the far side. So once we finish with the dissection, then you do the bone graft. For this patient, I use the mix of allogenic bone and FDBA and the alloplastic bone, which is a carpor. I mix 1-to-1, and the total amount that I used for this patient was about 2.0. So I mixed like a good amount of bone and then grafted them. So when I graft, I use the syringe from the FDBA and I carry with the syringe. And once you carry the bone, you make a space with the FLIR elevator, what you use for dissection. Then you press the bone, push the bone and fill the space. Then make a space again with the FLIR elevator, like the same action when you elevate the membrane. So you do you repeat the procedures until you can fill the mesial, distal, and the middle area. Okay, once I finish the graft, sinus graft, then I cover the window area with the PRF membrane that I prepared prior to the sinus graft. So once I finished graft and cover with the PRF membrane, I started to closure with the suturing. And I use simple interrupted sutures and horizontal matrix sutures. So this is like edited 6 times faster. So okay, I want to remind you, this is after dissection of sinus periosteum and the muscle layer. So you can see the previous opening window here. Then after dissection, like of the sinus membrane, then I grafted I did a bone graft mixture of allogenic bone and alloplastic material. Then covered with the PRF membrane and closed with the sutures. So this is right after the panoramic radiograph. You can see the bone graft here on the right side of the maxilla. From the CT scan after the sinus graft, you can see the bone is filled under the sinus membrane with a perforation. Since about a month later, you see the graft looks like this. And 2 months later, after extraction of number 26 and number 27, and a few months later, before the sinus graft of the left side. Left side I did almost same, but I made a window with the SLA kit LS Limmer, which is my favorite. So I did re-entry for the sinus graft right side and the left side maxillary sinus graft. Then I sent the patient back to my colleague and he placed the 3 implant. So this is the recent panoramic radiograph. I received it from my colleague, and he placed 3 implant and 2 implant on both sides of the maxilla, and both sinus graft was done by me, and this 2 implant was placed by me, and the restoration was done by my colleague. So this is my last slide, and thank you so much for visit my Ask Dr. Kim, GAO Ask Dr. Kim channel on YouTube. And if you like it, please subscribe it, and I'll be back with another case. Thank you.